Well, tonight, a Benton mother is warning of a potential side effect of COVID-19. Her daughter was diagnosed with what's called multisystem inflammatory syndrome after an asymptomatic bout of COVID-19. Channel 7's Paris Kane has her word of warning tonight from Children's Hospital. Paris.
This is where the once healthy 16-year-old spent 5 days after doctors were finally able to diagnose her. And weeks later, she's still not feeling 100%. Meet Molly Maxwell, a typical teenager on the Benton High School dance team.
She's very active, never had any health issues.
That is, of course, until recently.
She's always cracking jokes, making everybody laugh, and then all of a sudden, she was just down.
Her mom, Karen, says Molly was exposed to COVID-19 twice and tested positive in late November.
She was asymptomatic the entire time, 0 symptoms.
2 weeks later, however, that changed.
She started running a high fever, I would say around 102.5, and that's how it started.
Molly's lymph nodes swelled, and by day 2, she couldn't turn her neck. After a telehealth appointment, she was diagnosed with strep throat and treated with a Z-Pack. But by Wednesday, she was only getting worse.
Her fever actually was getting higher.
Friday, they went to the doctor, where she tested negative for strep, flu, and COVID-19. Karen says they were leaning towards mono, but had to send the test off to know for sure.
Gave her a Rocephin shot in case it was strep or something bacterial. And they said she should feel better within, 24 hours.
By Sunday, her symptoms started all over again, plus some new ones.
I was kind of done and thought we got to do something else.
Molly was diagnosed with MISC at Children's Hospital. According to the CDC, it's a condition where different parts of the body, like the heart, lungs, and brain, become inflamed. And most children who have it have had COVID-19 or been around someone who has.
I would have to help her with the simplest task. And so it was just hard to see that.
After 5 days in the hospital, Molly was sent home with steroids and blood pressure medication. Karen says she's a lot better, but still not 100%.
They were really, really concerned about that, not wanting her to do anything, any dance or any exercise, and just to take it easy.
Karen hopes other parents will hear Molly's story and keep an eye out if their children start to show similar symptoms after being cleared from COVID-19. Chris?
Well, okay, Paris Kane for us at Children's Hospital tonight. Paris, thank you. Karen says the doctors are not sure when Molly will be able to return to her normal activities.